Hello, everyone. Welcome to the Whole Health series. I'm Whitney Ortiz, the host of the Whole Health series and founder of Whole Health Self-Care and Eliana's Light. I am thrilled Dr. Iris Schrijver is here to share her expertise, insights, and wisdom on lifestyle medicine. Iris Schrijver is a lifestyle medicine physician who also is specialized in clinical pathology and molecular genetics. She is an adjunct clinical professor of pathology at the Stanford University School of Medicine and served as medical director of Clackamas Volunteers in Medicine because she believes that healthcare is a basic human right. Her dedication to patient care, science, and education has resulted in the publication of many original research articles, book chapters, and books. Her latest work, which we'll dive into today, is a book called On the Path to Health, Wellbeing, and Fulfilment, To Your Health. This book illuminates the connections between our body and mind and the world by which they are influenced. Thank you, Iris, for sharing with us.
Oh, thank you, Whitney. I'm so happy to be on your inspiring show.
Thank you. How about we start our conversation by looking into the foundation of this compelling book? Your book is really grounded in lifestyle medicine. And can you please tell us about this medical specialty and share how listeners can apply its principles to their own lives?
Yes, I'll be happy to. So, lifestyle medicine is the medical specialty that uses evidence based lifestyle therapeutic methods as a primary approach to prevent, treat, and reverse the chronic diseases that cause the most illness, disability, and death in our world today. And it does that by addressing the root causes. So it doesn't just slap on a band aid, but actually it digs a little deeper. And that supports the whole person and enables people and their families to adopt and sustain healthy behaviors that can improve their health, but also improve their quality of life. And that brings us away from disease management, as we so often do in healthcare today, to actual health restoration and a return to vitality. And that has a ripple effect. It has a ripple effect in how we can show up for life in our personal sphere, our families, our communities, our work life, and even healthcare itself. So, lifestyle medicine really is treating the whole person and whole health. And it has 6 principles. So let me go over these principles as part 2 of your question and also give some practical tips around them. So the first pillar of lifestyle medicine is adopting a whole foods, plant strong way of eating. And why do I say that? Because that's the way of eating that really supports our health and longevity over a lifetime. So the acronym for the standard American diet is SAD. And it is sad because what we get most of our calories from are processed foods, including processed meats. So, these are foods that are filled with salt and sugar and fat, and they are almost like food like substances, but they're really far removed from what Mother Earth provides for us. So, how can we change that? Well, every step toward a whole foods, plant based way of eating is progress. And for people who are just starting on this journey, I would say add in more fruits and vegetables into your diet. Now, when is there ever a doctor who tells you to add something to your diet instead of eliminating something, right? But it really works because fruits and vegetables have a lot of fiber, and uh, dairy and meat have none of that. This fiber keeps your microbiome really happy, and that influences your mood as well as your physical well being. So that's really important. And eat the rainbow because the different colors actually have different nutrients and different antioxidants, for example. So just adding 1 serving of fruit or vegetables each day, or ultimately to each meal, can make a big difference for your health. So that's the first pillar. The second one is optimizing physical activity. That lifts our mood, increases our lifespan, and also improves health. And we may know that, but it may be really difficult to get those recommended 150 minutes of exercise a week into our busy schedules, right? Well, if you break it down, it actually translates into 30 minutes, 5 days a week. And it doesn't have to be vigorous exercise. A brisk walk, for example, already counts. So my top tip there is to incorporate movement throughout your day. You can make a few steps when you brush your teeth even, right? So that's important. Just keep moving. The other thing is also to do what you love. Because if you're not a runner and you take up running because you think you have to exercise, you're not going to stick with it. So be a little adventurous, explore a few things, and stick with what you love to do. The third pillar is improving restful sleep. The recommendation is 7 to 9 hours for adults, and most of us actually don't even get the 7 hours of sleep each night. But every good day starts with a good night's sleep. And if you don't sleep enough, you are at risk for weight gain, but also at risk for developing multiple diseases, including cancer. So restful sleep is very important. The way to get there, there are multiple steps toward it, but actually what you can do today is try to get up at the same time each day and try to go to bed at the same time. That kind of regularity really is a good cue for your system. And the other thing I would recommend is to really stop screen time. Stop the blue light about an hour before bedtime. That also really is a good cue. The fourth pillar is to stop tobacco and exposure to other harmful substances. And I think we all know where that's at because we've heard a lot about it. But what people may not know is that if you stop smoking, you immediately slash your risk of a heart attack in half. So, there are immediate benefits to taking away these harmful substances. The fifth pillar is maintaining and making good social connections. That also is a really important one. Loneliness is actually a very big problem in our country today, and it was exacerbated through COVID. But social connections can counter that, and they don't have to be very deep, intense connections. Even these micro moments of connectivity, for example, a genuine smile or a genuine interaction with a stranger, already pay into that bank of wellness. And then finally, managing stress with healthy coping strategies. That's the sixth pillar. And that helps us develop resilience. And that's an antidote to burnout and also to developing illness. And the resilience itself can be a springboard to thriving. So the great thing about lifestyle medicine, that all of this is based on solid science.
So important. And I'm such a believer in that whole health, whole person approach to care, including self-care. And as you gave us such practical ways that we can support our whole health from where we are right now. And it's very accessible, as you say, do what you love. Small steps at a time count in the figurative and the literal sense.
They sure do.
And so where we can think about our whole health, looking across the spectrum of physical, emotional, mental, spiritual, intellectual, etc., social, can say where are areas that we, where we could up level a little bit, support ourselves more. And often in collaboration with others, as you mentioned. As you have lifestyle medicine at the core of who you are professionally and also personally and through this book, can you please now speak even more to this approach to health and the contribution of personal choices versus, say, genetics in health and well-being?
Absolutely. So I also, like you, subscribe to this concept of whole health and looking at the whole person. And as a trained geneticist, I can tell you genes alone do not determine destiny. That is really good news, actually. Your genetic information determines less than a quarter of the variation in human lifespan. And also, until the age of 70 or 80, it is lifestyle that is much more important than your genes. In my book, I describe heart disease a lot. For example, if you're born into a family where you have a high risk of developing heart disease, you might think, well, this is my set of genes and there's not much I can do about it. But that's not true, actually. The research shows that through healthy lifestyle choices, you can reduce your risk of heart disease by the same relative amount as somebody who's in the low risk category. So we can make a huge difference in our health. And only about a third of our sense of happiness is determined by genes. That's also a surprise, perhaps. So the takeaway is that you can make a positive difference in your well being by lifestyle changes. And you can do that in any phase of life. Now, what I want to add to that is that lifestyle is not completely based on personal choices. And I think that is something that we often see where people are blamed for being ill or that there's shaming going on. And that is so counterproductive because when we really look at the whole health and the whole person, we also need to look at the whole environment, the whole health ecosystem where that person resides. And that is influenced by many different things. The causes of disease and dis-ease of any kind really reach into the way how healthcare is delivered and into the social fabric of our lives. So let me give you an example. Many of us have adverse childhood events, and those have an influence on how we, how our risk profile is for the rest of our lives. Not that you can't do anything about it, but it's good to know that there is that influence. Also, income matters. The experience of people of color matters. How inclusive healthcare is and the access to healthcare and information matters. Education. And so, if we want to really empower people and communities, we need to look at what we are actually prioritizing at the local level and also globally. And that includes our sources of information. We have so much information at our fingertips right now, and that's great because it's there, but it can also be really confusing and overwhelming. And if you look on Amazon alone, in the past decade or so, the number of books on health has tripled. And if you look in the categories of diet or happiness, then you see a tenfold increase in books there. And that's Amazon alone, right? So what I advocate is that people are very critical and discerning about where they get their information and make sure that it is grounded in science, because where you put your trust can be a matter of life and death.
What a core takeaway for all of our listeners. And whereas you say there is so much information where it can be overwhelming, and you can also read a ton of different resources that are very well vetted and grounded in science, and at the same time to make those behavioral changes that can really affect in a positive way our well-being, our health, and our happiness. It is the kind of book that you offer that really helps us take one step at a time, looking at that big picture and seeing like how this really truly matters. And there are so many people right now, if we just focus on happiness for a moment, who are really looking at how can they be happier? How can they experience greater happiness? And so I love in your book that you address this. It's so timely. What are some of the key findings of the science about happiness that connect to health and well-being?
Yes. Well, the science on happiness and positive psychology is really exciting right now, and it is fascinating. You know, we now know that health and happiness really are connected, and that seems intuitively
Mhm.
right. But now there's also the science to back that up. And one differentiating factor might well be behavior. We know that people with better health habits often also are actually happier, and that happier people have a somewhat easier time establishing good health habits. So it goes back and forth, right? And happiness definitely affects longevity and reduces the risk for diseases. So that's all good news. But I do need to add a nuance because there are no guarantees in life, right? We're dealing with likelihoods. And so when we're going back to the science, then the studies are usually made of large population groups, of representative parts of a population. And there we can see the factors of health. But then there's always one person who says, well, I know somebody who smoked and drank and watched TV all day and didn't sleep much and was a grumpy loner. And still that person lived to be 100. And if you only looked at those factors, you might think that those things are the things that lead to health. And nothing could be further from the truth. Because what we need to do is look at a population scale, right? At large numbers. And there we can very clearly see what the factors of health and happiness are. So, one example of such a large study is the GRANT study, which is a study that went on for more than 75 years now. And it looked at happiness and health over a lifetime. And there are very few studies. I think this is the most comprehensive study there is on these topics. And what they found was that good relationships make healthy and happy lives. It seems like such a simple message,
Mhm.
but they really found that um, social connection is profoundly important and that loneliness is detrimental to health, happiness, and longevity as well. And it's the quality of our relationships that matters, not the quantity. And I think that's very good news for introverts, for example, that it really matters that you have loving, warm, and supportive relationships. And it can be just a few of them, but that's the most important part.
Mhm.
And going back to the science, the effects of social connection are measurable. So it activates the part of the brain that helps us relax, and it stimulates oxytocin, which is the love or the hugging hormone, as well as serotonin, which is the feel good hormone, and dopamine, which is important in reward and pleasure. And it even reduces anxiety. There are several pathways for that. So love and kindness are really life giving sources. And when we're cultivating these kinds of happiness, we can change our odds, we can change our likelihoods again for longevity and for good health. And personally, if you ask me, I think what we need the most today is compassion in addition to that. Compassion for others, trying to put ourselves into their shoes and seeing where they come from, but also compassion for ourselves. Because whether we're in healthcare or not, in order to do well, we need to be well. And then we can return to the whole person and to whole health. And in a sense, we can come home and also come home to ourselves.
Mhm. Mhm. Such an important reminder. And where this interview or session here today will reach those who are in the healthcare field and are also compassionate leaders throughout the social sector and in various other communities professionally and also personally, and our caregivers. So they are I'm sure, like I was, like listening to your words and saying, okay, yes, how important it is to find very meaningful relationships. And nowadays, being online more, you can find communities of like-minded individuals, of people around the world who you may never have otherwise met if it wasn't now for a greater focus on where people can connect to each other. And that genuine, authentic connection really does matter. So that's wonderful to hear that the science really backs that up, and how we can support others in compassionate ways to help them in their efforts to have meaningful, purpose-driven relationships through their family, their friends, or communities, and making a positive impact in the world. So thank you for all that you do to bring these messages out into the world, and for your tremendous book. You have so much wisdom in here, and so much history, and so much evidence-based reasoning around how we can live our best lives today in this time of great change that we are in.
Thank you.
So thank you. And how can people get your book? How can they also enjoy all that you have offered?
Thank you. Yes, I would recommend that they go to my website. It's lifestyleforhealthandwellness.com. It's all written together, lifestyleforhealthandwellness.com, because there they can find a discount code for the hardcover edition of the book. And shortly, there will also be a much less expensive ebook available. I think it'll also be on Amazon, but through my website, you will get the best price for sure. And they can also reach me through my website if they have any questions or if they want to follow up. I'd be happy to hear from anybody.
Oh, thank you for that. That's a very kind offer. And as we close here, I'd love to share a quote, if I may. This gives also a question for listeners to ponder. It's from page 264. It says, on the path to health and well-being, we need to understand where we came from, take a good look at where we find ourselves at present, envision a compelling future, and take some time for introspection. Which aspects of your health and well-being can use a boost? It's a great question for us all to consider each and every day as we move forward on our paths to health, well-being, and fulfillment. Thank you so much, Iris, and I will share links along with this recording.
Thank you so much, Whitney. It's been a great pleasure.